are some moments in life that change you forever. Hearing a doctor say the words, "Your child has cancer," is one of them.
After that devastating experience, I decided to devote myself to supporting other families. In the region where I live, not every child has access to treatment.
And for far too many families, what happens next doesn't just depend on the strength of the child. It depends on the strength of the system around them.
The mission of this project is very simple. It's giving all children the same chance of survival, no matter where they live. That's the mission.
Today, I'm joined by three extraordinary women who refuse to accept that geography should decide a child's fate. Isabel Veladri, who leads Foundation S's global mission to transform childhood cancer care. Dr. Leila Hassisen, a pediatric oncologist fighting every single day to give children a second chance. And Alejandra Mendez, a mother who turned a personal tragedy into a global movement for change. My next question to you, Isabel, what has been the biggest impact of the My Child Matters program so far? And could you also share, let's say, one initiative you are especially proud of?
The 280,000 children already reached thanks to that program. You have a huge number of stories. 60,000 healthcare professionals have been trained through My Child Matters program.
Leila, how has support from programs like My Child Matters helped hospitals like yours on the ground?
Honestly, My Child Matters have been part of my journey from the very beginning. What's amazing is that the tools we developed back then are still used today. We have been able to keep them going year after year because those were very important projects.
This isn't just a conversation about medicine, it's about determination and the future we can and we must create together. So let's begin. Before we jump into today's episode, I just want to say something from the heart. Over 93% of the people who watch this podcast regularly haven't subscribed. And listen, I get it. Life is busy. You click, you watch, you move on. But if you've ever felt like this show brings you value, if it has made you think, sparked a new idea, introduced you to something inspiring, then I have a small favor to ask. Please hit that subscribe button. It might not seem like much, but to me, it means everything. This podcast has always been a labor of love. No sponsors, no script, just honest conversations with people trying to make a difference in the world of healthcare. And your support, your one click, helps me keep doing that. It helps more people discover these voices. It helps this community grow. So if you're here, if you believe in this, please consider subscribing. Thank you for being here. Now let's get into the episode. There are some moments in life that change you forever. Hearing a doctor say the words, "Your child has cancer," is one of them. It's a moment no parent should ever have to face. But every year, tens of thousands do. And for far too many families, what happens next doesn't just depend on the strength of the child. It depends on the strength of the system around them. If we live in a high-income country, there's an 80% chance your child will survive. But if we live in a low-income country, that chance drops to 20%. Not because the disease is different, but because opportunity is. Today, I'm joined by three extraordinary women who refuse to accept that geography should decide a child's fate. Isabel Veladri, who leads Foundation S's global mission to transform childhood cancer care. Dr. Leila Hassisen, a pediatric oncologist fighting every single day to give children a second chance. And Alejandra Mendez, a mother who turned a personal tragedy into a global movement for change. This isn't just a conversation about medicine. It's about humanity, determination, and the future we can and we must create together. So let's begin. Isabel, Leila, and Alejandra, welcome to Drug Diaries.
Thank you.
Thank you for the invitation.
Pleasure. It's a pleasure and an honor to have you all on the show today. To begin with, Isabel, could you start by telling us about your role at Foundation S and the mission behind the My Child Matters program?
Yes, with pleasure. So I'm Isabel. I'm working at Foundation S, leading a wonderful program called My Child Matters program and tackling, childhood cancer. And the mission of this project is very simple. It's giving all children with cancer the same chance of survival, no matter where they live. That's the mission.
That's absolutely fantastic and very inspiring. And Dr. Hassisen or Leila, as a pediatric oncologist working directly with patients, what does the reality of treating childhood cancer in low source settings look like?
Thank you very much for this invitation. So I'm Leila Hassisen, the head of Pediatric Hematology and Oncology Department and president of the Franco-Africain Group of Pediatric Oncology. So I wear lots of hats. Treating childhood cancer in low resources setting is really about navigating both what's planned and especially what not. The biggest challenge is staying steady because we live with the high and lows conditions, and we must really stay steady because our teams relies on you to keep the direction clear. So in a single day, you're managing everything, the patient, the clinic, the logistics, families, your team, the hospital administration, the partners, and at the same time, you're training trainees and fellows. You get to make sure the next generation is ready to carry the work forward. And sometimes the issue is something as small as missing 5 cents nail. Sometimes it's about accessing a life-saving drug that can cost 20,000 euro. And most days, what you planned in the morning looks nothing like what actually happens. But you move forward with the energy and the group of all the group and the deep conviction that you can do better.
Wow, that seriously seems like a very tough job that you have at hand, and managing so many different complex activities, all impending priorities, can be a daunting task, and I can't even imagine managing even a % of that. So thank you for the introduction. And Alejandra, may I request you to introduce yourself and also tell us about your work with families and children that are affected by cancer through your role in patient advocacy and support network.
Thank you for this invitation. It's a real pleasure to be here. And as I have told before, Isabel, thank you for incorporating the voices of the people with the lived experience, we who have been there. Sometimes these kind of discussions are centered in them only medical or researchers or scientific. And I think it is very important that we, the families, the patients, the survivors, can be heard and can have a part in this conversation. So my name is Alejandra Mendez. I'm from Chile. I'm based in Chile, in Latin America. And as you said, I'm the mother of a childhood cancer survivor. And what I want to say is that after that devastating experience, I decided to devote myself to supporting other families. I just want to mention something that in the region where I live, not every child has access to treatment, right? As you mentioned in your introduction, the main factor that determines whether a child will or will not survive cancer is not the diagnosis or the kind of cancer that he has. Unfortunately, is the place where the child was born or where he lives. And that's something that really, really strikes and hurts, right? In my personal situation, living in Latin America, my son was diagnosed with a clear cell sarcoma, which is a super aggressive type of very rare cancer. There was no treatment available in Latin America for him. So I cannot imagine how it would be for a mother to know that there is treatment available at somewhere, but not accessible for your child. In my case, because of my husband's situation, we had international insurance, which is something super rare. Oh. I was on the lucky side, so my son was treated in the Northern Hemisphere, not in Latin America. So Pablo is alive. The access treatment that was not available in LATAM. So I think that is not fair. So we are devoted at Childhood Cancer International, where I serve as vice president today, trying to make that every child diagnosed wherever he or she is has access to on-time treatment, to the last treatment. And of course, some of them will die, but at least they should have the opportunity to access treatment. And again, I don't want to even imagine how it would be for a parent knowing that the treatment available that may save his child's life or her child's life is somewhere, but not for your child. So that's what we're doing at CCI with the support of Foundation S and many other very generous donors.
And I'm sure your first-hand experience of dealing with the situation is immensely invaluable to improve access and health outcomes for similar cases and children who are going through, and parents especially, who are going through a tough time. Thanks for sharing that. And could you also share a bit about the kind of work you do and what you're seeing on the ground in the communities you...
Personally, I think that to heal or to cure a child, we need to focus on the scientific research. Of course, what the scientific or the medical team like Leila and Isabel are doing is essential. And we as parents are very grateful for all what you're doing. Their work saved all these kids. So we are forever grateful for that. But unfortunately, low income or low medium income countries, many children die because of preventable reasons, right? Access to early diagnosis, of course, one of the biggest reasons, treatment abandonment, treatment adherence. And of course, the reasons of that is because sometimes the economic burden is so high. In these settings, I need you to understand, and Leila will understand that, we have few oncological centers that are usually based in the cities, right, in the urban areas. So families need to relocate for a year or for, cancer treatment is long. So families need to relocate. And very often the burden of that, economic burden of that is too expensive. Children will die then because of treatment abandonment. Families have other siblings left behind. They cannot afford to live for a year in a city. Very poor treatment adherence. Children who are like not attending their appointments. And very infectious diseases, because they need to have when you are having cancer treatment, your immune system is very low, so you can die of any just infectious disease. And because of that, many children die in this. That's why our survival rates are very low. Some, like Bolivia, next to Chile, it's only 20% of survival rate, right? And most of the children die because of these preventable reasons. So we at CCI cannot work with the breakthroughs of science or with our scientific research. What we do is we tackle those issues. We try to build home away from home with support of Foundation S, where we're building places where the families can stay. Transportation programs where the child can be transported in a safe way, not to prevent infections. Nutrition programs and education programs, awareness programs. And of course, we also want to help the organizations around the world. We have around 300 organizations that are members of CCI, located in every continent, in more than 98 countries already. So we support them in terms of trying to help them to fundraise their own funds, capacity development, giving them the opportunities to be trained in other regions. So what we do is like complementing, working hand in hand with their efforts that people like Isabella and Leila are doing in these settings. So having the last of the latest access, the latest to the best treatment available, having research and improving, that is super important. But what we do is complement that with the housing, nutrition, education, transportation, mental health support. And we believed in this holistic view that only working together, we will be able to not only cure the child, but heal the child and make sure he or she has the best quality of life, surviving and have the best quality of life after survival.
It's really heartbreaking to hear that a lot of the children do not survive the whole treatment because of preventable causes. And I want to take a moment to acknowledge that you are doing an incredible work, and this is going to have such an incredibly profound impact on the survival rates. So thank you for sharing those insights. And my next question to you, Isabel, what has been the biggest impact of the My Child Matters program so far? And could you also share, let's say, one initiative you are especially proud of?
Yes, with pleasure. So I will start with numbers, and behind numbers, you have stories. So behind 280,000 children already reached, thanks to that program.
Wow.
You have a huge number of stories, and behind that make you figure out what is behind. And 60,000 healthcare professionals have been trained through My Child Matters program since its inception. And this program is celebrating this year the 20 years anniversary. So it's since 20 years, that's the numbers. And beyond the numbers, as I mentioned, is you have a lot of stories. Some are happy stories, happy hands, some less. And you ask me which initiative I would select. I am a mother as well, so I cannot choose between my babies. So that's impossible. You need to consider that there is 164 projects within this program. Having saying that, I want to answer your question. And I think what makes me the more proud of is when you observe that thanks to the supports of capacity building, when you observe the empowerment of the teams locally, whatever the team, the healthcare professional teams, the families, when you see that they feel not only empowered, but you have the feeling that you're getting these teams off to flying start. In French, we are saying what make me the more proud of, and it's very rewarding for us as My Child Matters program head to see how they bring the story to the next level, the healthcare system to the next level in order to better take care of those children. That's what makes me the more proud of.
Wow, you have clearly dedicated so much of yourself and also Foundation S and Sanofi to this mission, and it's really inspiring. And the impact you're making through your work really comes through in the way you speak. You're so passionate about it, and it's so remarkable. Thank you for sharing those insights. And my next question to Leila, how has support from programs like My Child Matters helped hospitals like yours on the ground?
Honestly, My Child Matters have been part of my journey from the very beginning. In 2006, when the first call for project came out, Morocco submitted to two proposals. One was about early diagnosis and one about pain management, and both were accepted. I still remember how proud we were because those are our first big projects financed by the Sanofi. It was called Mon Enfant, Ma Bataille. And what's amazing is that the tools we developed back then are still used today. We have been able to keep them going year after year because those were very important projects. Then in 2011, I helped through the GFAOP to organize some of the first intensive training courses financed through the Foundation S and My Child Matters for nurses, pediatric surgeons, pediatric oncologists. Thanks again to My Child Matters. And this make us organize an accredited diploma called the Diplôme universitaire de cancérologie pédiatrique. And in 2014, the university diploma was officially accredited. And since then, over 70% of our team have been trained through that program, and we increased the number of pediatric oncologists in in Francophone Africa by 40%. So this was not only for our center, but for all across Francophone Africa. And our hospital have really become a place hub for pediatric oncology, a place where people come to learn, grow, share. We have been even able to publish our experience. But beyond the My Child Matters, Morocco has also had the support from Foundation S to develop the national strategy for childhood cancer and to support the GICC, the Global Initiative for Childhood Cancer. So thank you to Foundation. Yes, we have grown together.
Yeah, that's true.
Oh, that's really inspiring to hear the profound impact you're making along with Foundation S and bringing transformation and change, positive change to thousands of lives out there. So kudos to you. And talking about the clinical and emotional challenges, Leila, what are the biggest barriers to diagnosing and treating childhood cancer early in low-income countries?
That's really an important question. The truth is that barriers to early diagnosis vary depending on the country's socio-economical level. In the very low income setting, the challenge often lies in the community. There's very little awareness about childhood cancer, and unfortunately, a lot of still surround it. Some people don't even believe that children can get cancer. There is also strong reliance on traditional healers, which can delay access to proper medical care. In low middle income countries, the little higher economical level, the problem tends to shift more to the healthcare system. Many frontline doctors may not recognize the sign of pediatric cancer, and they might not know to diagnose it properly. Sometimes they even perform inappropriate tests, which can mislead the process and delay the referral. And in other case, they simply don't know where or how to refer a child to specialized care. And so whether it's question of myth, traditional belief, or gaps in medical knowledge and refer pathway, early diagnosis remain one of our biggest challenges. And sometimes the child may come at early stage, but if he don't have health coverage, if the family doesn't have money for transportation, lodging, they may refuse or abandon treatment. And sometimes even with health coverage, medication, important medication may not exist in the country. So those are the main barriers for the diagnosis and treatment.
Right. That's very well explained. Alejandra, from your perspective as an advocate, what impact have programs like My Child Matters had on the families and children you work with? And what kind of support is most valuable to them?
Okay, so we have had this alliance with Foundation S for over a year, maybe two, Isabel. It's a recent alliance, so we're very happy, and we hope that we will continue growing in this journey together. So the main program that Foundation S has supported is a home away from home program. I want to say again that before we started this interview, you and I were talking about, I know you're a father, you mentioned something about your daughter. So
Yes.
I just want to say that every parent feels the same, irrespective of where they are. And no matter how poor or uneducated he or she is, we all parents, we do whatever it's there to save our child's life. So, and unfortunately, as I mentioned earlier, and Leila just mentioned the same, treatment abandonment is never a choice. That would always be the last choice of a parent, because no matter how poor and educated you are, you know that abandoning treatment will mean that your child will die, right? So unfortunately, in low-income countries, that's the only choice families have, because as I said, because they cannot afford to live in the city. So Foundation S has generally supported the Home Away from Home program that was launched last year. And we are very happy to say that we received numbers of applications from Childhood Cancer International member organizations who applied for one of these grants. And we were very happy to have inaugurated 3 houses, one in Bolivia, in Latin America, one in Zambia in Africa, and the third one in Malaysia in Asia. And that has been a huge support. And again, I want to say that now we're just starting the second round. So hopefully this year we'll be offering grants to more organizations to be able to expand or build a new home away from home for these families. And I want to say that impact is been huge. And I had the privilege and the honor of inaugurating the house in Bolivia 2 months ago, Isabel, or 2 months ago, I think. And hearing from these families there that thank you to this casa or this house that Foundation has funded for them, he was telling me that if the house was not there, he wouldn't be able to stay in La Paz, the capital city, for his child Omar to have treatment. He stayed for free, absolutely for no cost in the house. And Omar, the boy who was around 3 or 4, was undergoing chemotherapy and radiation in La Paz. Thank you to this thank you only because of the house was there. So I still think about Omar, and from what I know, he's doing very well. And that kind of things are really amazing. So thank you, Foundation S, for this support. And thanks for that. We've been able to give the families the opportunity to not have to make one of the hardest decisions that a family can make, which is to abandon cancer treatment, because you cannot afford to stay in the city, even though the treatment is for free or you have insurance, but you cannot afford to live in a city and lose your job and, leave your other children behind in the rural area or whatever. So that's been an amazing support, and we continue to grow and continue to grow that program. And also Foundation S has been very generous and has given us some licenses to offer to all our member organizations to get capacity development for free through an alliance with Coursera, where they can take online classes and they can, get new skills and, better run and better administrate the resources that they have locally in the organization. So Foundation S has been a vital support, and the My Child Matter is a program that we hope continues for many, many years, and supporting and saving lives of children that are undergoing cancer treatment.
Absolutely. That's such a thoughtful initiative of creating those homes for parents or families who live far away from the city to get access to treatment and to be able to finish the entire course of therapy. And just so that I understand, in terms of the capacity, do we have enough space for patients, or do they have to queue up, or is it a first come, first serve basis? How does that work?
Yes. That's the saddest part. Yes, that's a very sad part. Unfortunately, before this house was built in La Paz, they had a small apartment where I think 5 or 6 kids to stay. With this house, the number has grown to 30. So that's amazing. And they always stay with one caregiver. It's a child with a caregiver, and that's something that it's invaluable. But there's still many other children in Bolivia and in many other countries that cannot access to that. So we need more support and more help. Our dream is that no parent has ever to need to take the decision of abandoning treatment, right? So there are so many countries, and we received, for this year, we received around 30 applications for new homes in the low-income countries of the world, every continent. And now is the hard part, Isabel, we need to review those, and of course, we hope we could grant each of these 30 organizations with a new home, but of course, we cannot do that now. So we hope that we will have to make the hard decision of deciding where it's needed the most. But of course, answering to your question, there are literally hundreds or maybe thousands of children that still have no access to housing while in cancer treatment.
That's really heartbreaking. And trying to understand the funding model. Of course, Foundation S is one of the pillars that supports these sort of initiatives, and that's incredible. But are there any other organizations or any charitable initiatives that helps us build the fund to be able to grow the capacity for these homes?
At this point, Foundation S is supporting this 100% this program.
Okay, right.
We are open to explore other alliances or other donors who may want to be part of this initiative. And of course, we are very grateful for Foundation S because it's a very innovative program in terms of tackling of trying to improve childhood cancer survival rates in low-income countries. And we have other very generous donors who support us in other programs that we're doing, but for the Home Away from Home program, we're extremely grateful for Foundation S and for Isabel, especially, who had the vision of understanding that medical breakthroughs or medical treatment is not enough. We need to complement and give the families the basic things they need, like accommodation, food.
And to complement Alejandra's answer, may I add that the door is open, newcomers, because the door is, we partner since 2 years to test and learn from this initiative. And as Alejandra perfectly reports, the impact is huge and the added value is just amazing. So that makes us comfortable to say, please come in and join join
Yes.
us or join CCI more precisely to support such an initiative. There is more to gain rather to lose.
Hopefully, we will be able to build home away from home in every low-income country because it's so needed.
And coming back to clinical and emotional challenges, and my next question to you, Isabel, how does Foundation S address not just medical treatment, but also the emotional and psychological support for families that the families need?
Yeah, thank you for the question. And you're right to mention beyond, because I think the foundation and the basic is all what Leila is executing on the daily life, because it's without having those skills, those expertise in low and middle income countries, the rest could be perceived as, there is no room to execute or to manage pain or palliative care if there is not the basic treatment there or the basic expertise there. But yes, beyond the medical, there is the initiatives that Alejandra just described, the Home Away from Home initiative with CCI, which I think we have a very good design on what is on that. And the second would be all what we are doing together, and that's exactly reflecting the three of us, that how all the projects around pain management and palliative care, where I realized when I came in that field that palliative care is not at all the same spirit that for adults. I will speak to all the mother or father in the audience, that there is, if the mother or the father and the caregivers feel good, it will be much more better for the child, and he will have all, the tool to fight. And that's critical. And that's what is about in palliative care, to take the family as a part of the treatment, and that's not for the pediatric oncologist. The pediatric oncologist is managing, the child, and that we need a multidisciplinary team who take care of the mother, take care of the father, because if they feel good, if they are not stressed, it's good for the child and it's good for the outcome related to the cancer of the children. So that's all the project related to pain management and palliative care that embedded all what I'm just mentioning are critical, especially for childhood cancer, because it's a tsunami. And also you have in front of you, you do not have the patient who takes a decision for him home. You have it's parents who are taking decision for their child. So you need, in terms of relationship between the medical team and the patient and the parents, it's something very special. So that's very important to consider and to support some project around this. And last but not least, I would mention very specific initiative. We are currently, through the call for proposal, we are currently supporting a project in Uganda and Ethiopia. I would say in the frame of families empowerment, but in a different manner. As Leila, you mentioned that if there is no health insurance, you feel powerless, because you cannot, suggest treatment because they cannot afford. So that they will not be able to execute it because they do not have the funds.
Alejandra, I'm going to come back to you and ask you this question, that you speak with families at some of the most difficult points in their journey. What are the most common challenges they face, be it emotionally, logistically, and financially after a diagnosis?
Okay, thank you for the question. And I just want to follow up on what Isabel just said, right? As we've been discussing, having a child with cancer is I think it's one of the hardest things that a mother or father can ever face, because you're not only facing the possibility of the death of your child, but also that the only way of saving his or her life is putting him or her through a very painful, aggressive, long treatment that will probably leave some after effects in his or her body. So you have to understand what these families are living, right? This is I think is one of the hardest news that you can, as you said at the very beginning in the introduction, like your child has cancer, and it's devastating. And the whole process is devastating for any parent, no matter where he or she lives, right? So having that in mind, I want to build up on what Isabel said, right? When you are in that situation and you all, of course, you need to cover the most important, I mean, you need to have like transport money for transportation, for housing, for nutrition, what we've said. But mental health is essential, and in most low-income or low-medium-income countries, the states cannot cover that. It's not that they don't have the will to do so, but they have to prioritize. So they will not cover mental health, right? So following that that line of thought, I want to say that mental health support is crucial for the caregivers. And as Isabel was saying, when a child is sick, especially if he or she is under 11 or 12, the child will not look at the psychologist, the social worker, or the oncologist. He or she will look at his father or mother, right? And if the mother, I would say mother, but I'm referring to either father or mother, if the caregiver is stressed out, anxious, having not under control, and it's not like the child will feel that, right? Immediately, you can read, the child reads you. So when the caregiver is emotionally under control, is supported, the child also will feel that. And we have measured that in some, we always like data and, have to demonstrate this. We measured like when the caregiver had mental health support, the child slept better, ate better, and made less fever. And these three components, better eating, sleeping, and less fever, of course, had an impact in the outcome of that. Leila, you are the oncologist here. You can say that child having fever, the treatment needs to be postponed, and time. So these three factors are so important, right? So I would say that mental health support is crucial for their families. And I want to say again, what the families are living and experiencing is absolutely extreme, right? That they probably are 5 kilometers away, right? So this little thing, you cannot decide what the family needs in that time. Making a phone call to your other kids that you left behind, you don't know how the guilt that you feel. That was my situation. I left behind my other two sons because we traveled with Pablo for our treatment overseas in another country. So even though the other children are maybe taken care by grandmother, but no, the feeling of having the possibility of talking on the phone with your other child, that you're guilty because you left behind. You needed to choose between your children. And of course, your choice is for the one that's sick, right? So I think that these little things has such an impact in the families. So I would say that more than looking at a patient-centered care, I think we should look at a family-centered care, right? Family-centered care where the whole family, because the child is not an individual. The child, especially if it's under 12, it's part of a family, right? Of a family. So the whole family need to be supported. I always say that we're 5 in my family and only 1 was diagnosed with cancer. But the 5 of us are cancer survivors. We all went through this. We all had our scars. We all needed to be supported. It was hard for everybody. So only 1 got the diagnosis, but everybody lived the journey. So I think that a family-centered care is super important. I think it's something that will really, that mindset, if we can open that mindset, will have a huge impact in not only reducing treatment abandonment and treatment adherence, but also getting the best quality of life possible to these families after they finish treatment.
Thank you for sharing those insights, Alejandra. And on the topic of training the future, Isabel, training healthcare professionals is crucial. And how does Foundation work to build sustainable pediatric oncology teams in low and middle income countries?
Oh, I think for that question, I will give over to Leila because
yes, of
her
course,
experience on that.
Thank you, Isabel. So I think the project make itself sustainable by the quality of what you deliver, and the training for pediatric oncology in Francophone Africa is really the example, but it's teamwork. We just need this support that allows to the physician to come to be trained, because they need the support. They have 6 month training here in Morocco. They need to register at the university. We need to bring here the mentors, the trainers, and the foundation is supporting this. Thanks to their support, we have trained 107 physicians to pediatric oncology. They were able to create 10 additional pediatric oncology units throughout Francophone Africa. They became mentors. We are like family. The pediatric oncology diploma is not only a training, it's a family. So this was possible thanks to the My Child Matters and Foundation.
Thank you for sharing those insights, Leila. And my follow-up question is, what skills or training are most urgently needed to transform childhood cancer care locally?
It is sure that we need the clinical skills and training to improve the direct care, not only for the physician, nurses, psychologists, dietitians, data managers. So it's all person that helps to improve the care in pediatric oncology, but it's just one part of it's not all, because many of us work in centers that are not only providing care, we are also leading training and research. So we need to be prepared not just to treat, but also to teach. We need the training in clinical education, research methodology, and pedagogy but at the same time, the burden of this work is real. So we face constant pressure emotionally and operationally. So we must also be trained in self-care, how to take care of ourselves and to take care of the others. And this includes stress management, conflict resolution, leadership development, and also in this foundation have been supporting us. And for those of us who have a leadership role, who are head of pediatric units, head of departments, we need to be trained in the management, healthcare systems management. This is really essential. So the list of the skill we need is certainly very long, because we need the clinical expertise, communication, mentorship, advocacy, data interpretation, negotiation, teamwork, crisis management. So this is really a long list, but we have time. We need to have timeline, when to be trained for the clinical skills, then for the management, then for the leadership, and so on.
I think you brought out a very important and often ignored point, is that you deal with these patients day in and day out. You deal with the children, and you see so much of suffering and pain day in and day out, every single day. How do you look after yourself after dealing with so much, and what sort of burden does it place on you as an oncologist when you arrive home at the end of the work of a tough day? How do you feel about it, and how do you keep yourself so positive and so mentally strong?
Write a lot. I have my diaries, the hospital diaries, since I began head of departments, means 5 years diaries. And I have my personal diary since 1986. So yesterday I put my list of the make me positive, like having a massage, taking coffee with my colleagues, to go to the sea, the beach, go with the family. So just keep focus with your list of positive things, and you go feeding yourself. And I have really an amazing team. So sometimes they feel bad, and then Amina, my colleague, will say, just come, I'll hug you. And then we hug ourselves take a coffee and then gone for the whole day, mainly about human interaction. And avoid negative vibes, avoid them.
Well, there's so much to learn from you and your indomitable spirit and strength and courage. So thanks for sharing those insights. And Alejandra, I'm going to ask you a question which might sound a bit long, but you've seen firsthand how the quality of care varies from a family's point of view. What skills or behaviors in healthcare professionals help build trust and reassure parents during treatment?
It's very, very important that we trust the doctors or the staff that is curing our children. And I want to say, from a parent's perspective, after you get diagnosed, your main concern is, of course, that the right medical protocol is defined. But after that, when you know the diagnosis and the protocol, what really our highest priority is the adequate care of our child's pain. Right? We are not scientists, most of us, and it can be very traumatic to see your child in pain, knowing there's nothing you can do. You know, the sight of a child in pain, it's hard, even if it's your own child. It can be very traumatic to have to force a child to stay still while he or she is receiving a painful procedure. So these situations, parents tend to disengage. Am I using the right word? Disengage. Yes. From the treatment, right? You think you see it as they're torturing your child, yet, and of course you understand that rationally that's needed, but it's so traumatic and so hard for parents. So I think that I would say that as a part of parents' perspective, it's very important that doctors can understand and acknowledge our feelings. You know, it's not natural what we're going through. It's not, no parent should ever be undergoing that. So supporting, and again, going back to mental health support to caregivers, and concretely, not only ideally having a specialist that can, support in terms of psychologists or psychiatrists if needed. But I think that engaging parents in treatment in some ways can be so helpful. And so, having the feeling that there's nothing you can do to ease or to soothe the pain in your child is so contradictory as a parent, right? So my personal worst memories of treatment was when my son was in pain, right? And there's nothing I could do. So training or teaching us how to be engaged in that really makes you the feeling that you're doing something to ease this suffering. So the training us like maybe to do some massage while the child is having this, for example, a painful procedure is usual when you need to get the spine,
epidural.
Something like that. Maybe you can help me, Leila, when you have to remove
lumbar puncture.
Yeah, lumbar puncture, exactly. That's very painful. And usually parents need to hold the child still while you are kind the lumbar puncture, which hurts a lot. It's like an epidural for women. Those of us who are mothers. So teaching or training us on maybe how to massage the child during a painful treatment. That makes us feel that we are engaged, we're doing something, we're part of that. So, and this really gives us that we have some control on things. So as I mentioned before, parents need to be under control, need to be supported, need to be taken care of, need to be acknowledged as part of their patients as well. So these kind of trainings, it's very, very important, especially in low-income settings where, because of cultural reasons, very often parents or family members are not really, they don't feel like they can ask, or they can, ask questions or ask to be involved in some decision makings, So I think that training is, I would say, to put it in one word, is like the medical team should listen more to the parents and acknowledge more, because we are grieving. And grieving, it's not only if a child dies or does not survive. We are grieving because of seeing, our child suffering and going through that. So listening to parents, acknowledging that will help a lot. And again, that will get a better outcome of the disease, because we will transmit that emotions, or parents will get that emotions of being, supported, and the child will feel that as well. So yeah, maybe if we can feel that we are a little bit part of the team, so training in that kind of little actions that can be seen like we are not in the opposite side, but we're together trying to cure, to heal the sick child.
And I think the feeling of helplessness as a parent when your child is suffering and going through that pain is unimaginable. And my follow-up question to you is, how do patient organizations like yours help bridge the gap between clinicians and families?
Clinicians and families, yes, that's very, very important. We're advocating a lot, and I can talk a lot about that, but maybe later, about, training or trying to give tools from the parents' perspective to the medical staff, right? In terms of the language they use. And some of you use the word fighting in this conversation. And fighting cancer, or being warriors who fight a disease, being inspiring, or being, that has some negative emotions in the parents and the patients, because just to put it very generally, when you feel that the expectations of the medical team is for you to be a warrior, superhero, brave, to be, and this is what we feel, right? And I said we because I've been working with families for over 20 years, and the medical team make us feel that we need to be inspiring, and then we're inhibiting the real feelings that, of course, an adolescent or a child with cancer, it's frustrated, it's in pain, it's like, it's not, it's a hard time, so you have the right to be, angry, and parents as well, right? To see, I'm fed up, I don't want to be here anymore, I want my child, this is what was not a choice I made. Of course, I wouldn't have taken that choice of being inspiring to others, seeing my child suffering. Of course not. Who would choose to do that, right? So little things like using and creating awareness of the language we use, medical team, to referring with the best intentions, I understand, and with the intention of giving us courage. We need to be acknowledge the feelings we are having, right? So we always try to do these kind of things and lower the bridge or the gap between the communication. It's very, very important. Communication needs to be open, needs to be understandable, and so there's so many things we do in that kind of things, in empowering families to ask questions, to be involved, to ask for support in different ways. So what we're doing is a lot of advocating for that, because we've been there. We represent families and patients from over almost 200 countries in the world, and we really want to make our voice be heard. And we are very grateful that more and more we've been incorporated by the stakeholders in the decision making, by the WHO, big hospitals, and big programs like My Child Matters, where there's in all the committees, there's parents sitting there making decisions. Giving our perspective to make decisions. And that's, I think, it's taking medicals out of the box. And that's how My Child Matters, that's how the Home Away from Home started, right? There was a parent in the discussion, and they was said the importance of not only spending resources or giving grants to medical research, but also supporting families in other important components like housing, and having this double vision of housing and access to treatment, of course, will save more lives, right? So we're very grateful for all the stakeholders who are incorporating the voice of people with lived experience, survivors or parents, in the decision making. So we really advocate to that our voice is included, and in little decision makings and in big decision makings.
I think what you said about normalizing vulnerability is so profound, allowing people to go through the emotions they feel instead of suppressing, and just go through the emotions that any human would feel. I think that is profound, and I never thought it that way.
And we always, we strongly believe that the basis of a healthy adulthood is being able to express your emotions, right?
Yes.
To talk about your emotions. So if we are not allowing children or adolescents to say, I'm afraid, this is something I hate, I want to go, this is not, even I'm scared of this, right? I'm frightened of what's happening. I just want to run away, right? But on the other hand, the message that they're receiving is that you need to be strong, you are resilient, you're inspiring, you're a superhero. And of course, like you feel you don't want to disappoint the
Exactly. Yeah.
expectations that they have put on you.
Yeah, it's like keep smiling no matter what you're going through and just put a smile on your face. That's I think what you said is really, it has moved me beyond imagination because I never thought it that way. And I, like everybody else, I would just encourage them. And you're a fighter, you're dealing with this situation so well. But it's actually important to allow them to go through the emotions that they're going through. Thank you for
Thank
sharing
you.
those insights.
Thank you for your
Uh,
comment.
uh, and Alejandra, is there a story of a child or family you have supported that continues to inspire you in your advocacy work? And what lessons can we all learn from that experience?
There are hundreds of millions of stories that I see with my patients. And one of them was Walter. He's adolescent. And one of the programs that we support in CCI is in-hospital schools, right, where children who are undergoing treatment can go to school. But beyond the academic, that they will continue with their studies, we have, again, measured and registered that has a positive impact in their mental health because there's a feeling of continuity, of taking them away from the disease, and they have to study or read a book or da da da. So I volunteer and I teach. I still do that once a week. Every Thursday morning I teach in the hospital. That's one of my favorite moments of the week, when I spend time with the children there. And Walter has not been to the classroom for the last couple of Thursdays because he was hospitalized. In the fourth floor is the hospitalization, and third floor is the school inside the hospital. You know what I mean? So I went to his room and asked him how was he doing. But before into the room, I saw his chart. And he was not doing well. There were bad news, very bad news for Walter. Things were not going well at all. And he was an adolescent, so he unfortunately passed, but he was then by 15 or 16. So after I read his chart and I went to the room, and he was really not, you could clearly see that he didn't want me there, right? He was like, and I was, Walter, do you want us to do this or that? How are you feeling? And no. And I really tried. And then after some minutes, I understood that he didn't want me there. So my immediate reaction was that he was feeling like that because he knew the bad news. He knew what was going on, and he was, of course, affected. So I said, okay, Walter, I'm leaving. And he said, and this is something that I will never forget, he said, Mrs. Mendes, I would love talking to you, but tomorrow I have a test. I have to read the Ulysses, which is a book, a literature book, and I haven't even started the book. And the test is tomorrow, so I really need to read the book. I really need to read. I cannot be late. I'm so behind. And immediately, that makes so much sense to me. Walter was as any child in that moment. One of my sons was 15, and he was also reading a book for school, right? And that was his concern, his bad humor, or whatever, was because he was late in schoolwork, right? So not because cancer was, or the effects of cancer. So the way that in-hospital schools take these children away from cancer and give them the worries and the concerns of a regular teenager, like any other child do, that's amazing. And I will never forget that. So I'm really, truly advocating for in-hospital schools, hopefully in every hospital, so that the children can have at least the sense of a real life, having to do homework, having to attend to class, meeting friends, meeting peers that are undergoing the same situation. And so I will never forget Walter. He passed, but he is always in my heart and gave me the motivation to continue. I humbly volunteer only one morning a week. That's all I can afford to do. But really, it's that kind of stories always stays with us and remind us of how little things you're doing can have a huge impact in the lives of some children.
Wow, that really moved me. That story is really profound. Thank you for sharing. And Leila, I'm sure you come across so many patients every single day. Is there a story that you would like to share of any patient?
We often think that our professional calling comes or begins with the powerful encounter with the patient, but that's not always true. Yes or no, because sometimes the patient is not the one we're expecting. So in my case, I didn't find the pediatric oncology. Pediatric oncology found me. So it began in 1993 when we were at the medical school, like for level of the medical school. I was like 23 or 25. One of our best friends in the group was diagnosed with medulloblastoma. We followed his journey from the moment of diagnosis. It was like the bomb in our group. Diagnosis, treatment was done abroad, and eventually he returned back home. But when he came back, he was no longer the same. He was changed by the illness, by the disease, by all the treatment he received. And this friend passed away 25 years later, but he passed away from the long-term consequences of the disease. The disease killed him 25 years after. So this was the first story. Then in 2003, my father was diagnosed with multiple myeloma. He underwent autologous transplant and also abroad, because at this time this was not done in Morocco. 10 years after he passed, but before he passed, he told me, Leila, when will you become the boss of your center, develop the transplant program? So I did. We developed the autologous and the allogenic transplant. And in 2023, my mother needed an allogenic transplant, and she received the transplant. So looking back, I realized how my path has been shaped and almost orchestrated by those deeply personal moments. So this is how I came to pediatric oncology, and this is why I remain in pediatric oncology.
Wow, it's so inspiring to see that you always had this mission in your mind, and that mission was fueled by the personal experiences and the personal stories that you saw, and it almost became a mission to fight this condition. That is really, really inspiring. Thank you for sharing that experience. And Isabel, when you hear these stories, what keeps you personally motivated in this mission?
You know, it's when I invite everybody around this, listen to this webinar to spend 15 minutes with Leila and 15 minutes with Alejandra, and then afterwards you will be able to claim mountains. You will, and whatever it is, Tubcal in Morocco or near Santiago de Chile, the mountains. You know, those stories. You know, Foundation S is the philanthropic entity of the group Sanofi, and potentially in the audience we have attendees from pharma industry and yes. We are in the daily life. We need to develop ourselves. We need to adapt ourselves. Adaptation is key in the current world in business. Humility is very important, and also active listen to the needs. And I think by listening to Leila and Alejandra is like a training on those 3 soft skills.
Absolutely.
On a daily life. So it's what it inspires me is that when I listen to those stories, I'm able to be fully positive and solution oriented, which is what is asked to everybody. And I would say that today, and also to find my own place within, you know, I also very, very impressed by all the work Alejandra is doing in advocacy, all the work that Leila is doing on behalf of your team and beyond with the GFAOP. And what is my place there? It's not only supporting projects. And I think that all the audience would have captured that there is
very important stories, that all what Leila and Alejandra are doing is useful. And sometimes I challenge Leila or Alejandra, say, okay, it's emotionally highly impactful. It's very useful. Nobody bring a debate on that two components. How we show the impact. And that's a conversation that I see Alejandra and Leila smiling, that's my added value, because beyond being useful, beyond the stories, how together as a group, and I love working with those two, how together we showcase the impact on what you are doing, because that's the third component where it connects the dots. It's potentially that will convince decision makers either in the institution or within the audience. What would be the impact if I jump into that game? I partner with CCI, I partner with GFAOP. What would be the impact for my organization? Beyond all what we listened since 1 hour, the stories which are very important in a world where communication is key and central. So that's my inspiration, to humility, adaptation, solution oriented, and listen to Leila's needs, Alejandra needs, and do my best to support.
Thank you for sharing those insights, Isabel. And as we are approaching the end of our conversation, I would like to ask you all, if you could leave our audience with one final thought or wish when it comes to tackling childhood cancer globally, what would it be?
WHO set a challenge of getting up to 60% of survival rate in childhood cancer by the year 2030, right? So that's our challenge, and we're all looking for that, and I'm sure we will get there. Final thought would be that for the people who's listening to this podcast, is to understand that in these settings, low-income settings, we need to work together, the scientific, the research, the medicals, together with the civil society or the NGOs or the nonprofit sector, because we are the ones who provide components that the states do not provide. We, working together, will be able to hopefully reach or surpass the 60% survival rate that the GICC or the WHO's set for the year 2030.
Thanks for sharing those insights. Isabel, Leila, would you like to add your thoughts as well?
I think the next goal, or the big goal, is how artificial intelligence capabilities can speed somewhere, somehow. And my take-home message and my final word will be, let's play the colibri approach. My Child Matters, it's a very well-designed program, open to everybody around this audience to join and to contribute. Come with us.
And another follow-up question, Isabel, is how can people like us, the common people like me who are moved by today's conversation, how can we support Foundation S and get engaged in the work that you're doing?
I think that's it's connecting the dots to directly to go to co-funding project that are already demonstrate already that it's working. So we have strategic partnership, and the organization or the funder can come in. It could be through skill sponsorship, because as Alejandra mentioned, and potentially Leila, there is need that you can list, you mention leadership, you mention negotiation. So I think that people within the audience do have strong skills on that dimension that can also provide value as speakers during training that Leila is organizing. Whatever, it could take many different means, but yes, that's not a big issue to find.
What you're doing now, giving us visibility, that helps a lot too.
All right,
I think honestly, I've been working in the pharmaceutical industry for 24 years, and I also had a stint with Sanofi in the early part of my career, and I had no idea of this incredible work that Foundation S, you all are doing. And like me, there are millions of other people who are oblivious of the work that you guys are silently doing. So I think it's very important to make more people aware of such an incredible impact that you're making in the society. And I consider myself really privileged, and it's an honor for me to showcase this story and bring awareness on this topic. So thank you for joining. And Leila, if you have any final comments before we conclude the episode.
Yeah, thank you. So our objective that no children with cancer should be left behind. They should all have access to care, and I don't see really how this can be achieved, even if we have the health coverage, the universal health coverage. It's not enough. I think that care of children with cancer or critical illness should be treated and considered as a sacred duty and non-negotiable obligation for every community. So this vision may seem utopic, but we are allowed to dream. So this is my dream, but also possible. Thank you very much.
Thank you. And that brings us to the end of our today's conversation. And what we've heard today goes far beyond statistics and survival rates. We have heard what it means to stand on the front line of a global health challenge, whether that's in a hospital ward, a policy meeting, or by the side of a family navigating the unimaginable. We've talked about the urgent gaps in access, the power of collaboration, the incredible difference that can be made when people and programs put children first. Dr. Leila Hassaissen, thank you for bringing the voice of the clinician, the one who not only treats the disease, but carries the weight of hope for every family that walks through her doors. Alejandra, thank you for being the voice of so many families and children who don't often get a platform, and for reminding us that advocacy isn't just about raising awareness, it's about building bridges, creating change, and fighting for dignity every step of the way. And Isabel, thank you for showing us what committed leadership looks like, how Foundation S and programs like My Child Matters are turning global vision into real, tangible impact on the ground. This conversation has been a reminder that when we combine expertise, empathy, and action, we create something really powerful, something life-changing. And to our listeners, if this episode moved you, please share it. Let's amplify the work being done, the stories being told, and the future we are trying to build, where no child is denied a chance to survive because of where they were born. So thank you for listening, and to Isabel, Alejandra, and Leila, thank you very much for everything you do and for sharing it with us today. Until next time.
Thank you so much.
Thank you.
Thank you for the invitation. Thank you.
Very much.
Thank you.